All right, welcome back, guys, to part two of management of concussions. So, what you do outside of the clinic. So, probably the most important aspect of treatment of concussions is the management of symptoms when you're not in the clinic. And it's also the most challenging aspect of concussion management because there's so much lifestyle modification that has to go in to treatment. So, for example, if you're a young athlete, this might mean you might not be able to go to school, you might not be able to read, you might have to significantly modify your activity levels, everything from using your cell phones to reading. There's huge modifications that has to go into the day-to-day life of following a serious concussion because, as I talked about in my first video, it's a metabolic injury and you have to reduce the amount of strain happening on your brain. It might not seem like it's overly challenging, but there's a huge component of day-to-day life that has to be modified in order to get the results, because if you're doing way too much outside of the clinic, your brain is not going to get adequate rest in order to properly heal. So the biggest thing that myself and Shalene are going to offer you for concussion management is education on what you're going to do for all the time that you are not here. It's going to be challenging, and there's a lot of working with young athletes, their parents, their teachers, or employers, managers at work, whatever, so that you can still have some aspect of a life while managing your symptoms. So that's all that we're going to talk about regarding concussions. Tune in next week for a new topic on Smith Saturdays.